It's Claire Williamson here, and I work for the Nottingham and Nottinghamshire CCGs, and I'd like to welcome you to today's webinar on managing and responding to early deterioration. It's great to see so many people are starting to log in, and just while they're doing that, I just want to do a little bit of housekeeping. Just let you know, we've got the chat function at the bottom. Well, it's at the bottom of my screen, it might be different for you. And I can see a couple of people are starting to introduce themselves. So please do introduce yourselves, say hello, and continue to use that chat function through the webinar. You know, that's there for you to let us know what you think of what we're saying, and you know, let us know if you need clarification on anything. All right. As well as the chat function, we've got a Q&A function as well. So please use that to ask your questions. We've left a Q&A section at the end of today's session. Sorry, I just realised I didn't have my video on. Hello, everyone. Sorry, you can see me now. I do have a face. Yes, sorry. Q&A function. We've got Q&A at the end of today's session. So pop in your questions into onto the chat function or onto the Q&A function, and we'll get to those at the end of today's session. Anything we can't answer, we will endeavour to answer in the next week or so. As well as those functions, we will be using the polls function. We find it so useful. It gives us that bit of feedback quickly about what's happening. If you can't see the poll function, we still want to hear from you, so do pop your answers in the chat if you can't use the polls. And just remember, if we do a long poll, what you might need to do is scroll for the poll. All right, you might just need to scroll down for the poll, so please do that. So without further ado, I'd like to launch our first poll, and we just want to see where everyone is, where everyone's joining us from today. So let us know what kind of service or organisation are you representing. If it's other, click other. Let us know in the chat if you'd like to. Everyone's welcome here, and I know and this is one of those scroll for the poll polls. Do just let us know where you're from. We're really keen to know where you're from, and also what area you're from. I know there are some people joining from outside of Nottinghamshire today. Welcome to you as well. And just let us know in the chat where you joined us from. It's very exciting to have some extra people along today. Lovely. So I think we've had that poll up for a long time. If we see what kind of results we've got there, please, Annie. Lovely. So residential home care, nursing care, that's lovely. Hi, everyone. It's lovely to get some good representation. Lovely. Oh, we're popular in Mansfield and Ashfield today. That's exciting. And the Nottingham County Council and City Council, other and unsure. Don't worry about it. That's lovely. Thank you so much. It's really good to know where you are. That's great. So let's move on to the next slide and tell you who we all are. So just to introduce the team. So we've got Michelle. She's our early deterioration project coordinator and trainer. Some of you may have already met her. There's myself, Claire. Lisa Hodgkinson. She's our interprofessional learning facilitator. Here she is. You may recognise Lisa from the webinar 2 weeks ago as well. And we've got Bridget, Natalie and Samson. They're our support from the Patient Safety Collaborative team as well. And joining us as well today, we've got Christian Morgan, who's registered manager at the Beaches Care Home. And he's here with us, as well as Annie Palmer from the Academic Health Science Network, who's helping out behind the scenes, and we're very, very grateful for that support. So thank you for joining us today, and you'll hear more from them later. So if we just go on to the next slide. I'd like to launch another poll here, just to see, are you already using a deterioration tool in the area that you work in? So if we can launch that poll, please, Annie. So yes. Are you using a tool? Restore 2, you might be using Restore 2 Mini, Significant 7, Stop and Watch. You might not be using one, or you might not know what a deterioration tool is either, and that's fine as well. So just while people are answering that poll, I just want to give a big shout out to the Wessex Academic Health Science Network and Hampshire CCGs. They developed the Restore 2 and the Restore 2 mini tools and resources, and they've shared them with us and nationally, and we're just really thankful to them for their hard work in developing those tools, and thanks for sharing them with us. And if we just have a look at those results, please, Annie. Lovely. So quite a lot of people using Restore 2, brilliant, and similar, in fact, exactly the same, not using any tool at all. So that's really good. And stop and watch. And another one, please tell us in the chat what you're using instead. That would be brilliant. So you know, Restore 2, you're already using it. Hopefully, you know, please comment in the chat and talk to each other about what you find useful about it. You know, hopefully you do like it the same as we do. And for those that aren't using one, I really hope at the end of today you might consider Restore 2 and what we've got on offer to help you adopt that. So that's lovely. So why Restore 2 and why do we want to recognise deterioration early? So what it does, it supports better outcomes for those that we care for. By recognising deterioration sooner, it can prevent more serious illnesses or deterioration. What Restore 2 does is it supports us to do that, but also supports appropriate action and according to the resident's care plan and treatment escalation plan. It ensures we can act with confidence and ensures we can act with competence to measure a complete set of physiological signs or observations, and it supports the escalation of that to another health professional in a timely manner, and also with the right and relevant information to aid that professional's decision making. Yeah. I just want to provide some assurance to you as well. You know, I know we started the rollout of Restore 2 during COVID, and I just want you to know that we're committed to Restore 2 for much longer than just these COVID times. We're not going to shut up about it anytime soon. We believe it is the right thing that we should be doing for the residents and those we care for in Nottingham and Nottinghamshire. Restore 2 is being promoted across the country by the Patient Safety Collaboratives and also endorsed by the British Geriatric Society guidance that was published on the 30th of March. That was the Managing COVID-19 Pandemic in Care Homes, which our very own Adam Gordon and Anita Astle contributed to the writing of. Yeah. A bit about how can we help you use Restore 2 in Nottingham, and it's a trainer approach that we've used in Nottingham, but we don't limit the amount of trainers you can have in your home. And by going through our training packs and the support that we can offer, we'll support your trainers through a competency framework to ensure you've got the confidence in using the tool, but also training others in use of the tool. Okay. You may have also received training from some of our ECRT team members. They've also been supporting us to deliver the full training pack. So big thank you to the ECRT teams. You've been really helping us, and with really valuable input and support that you've been providing to care homes. Another important part of our role as the Restore 2 team is our commitment and sustainability of the tool. So like I said, Restore 2 isn't going anywhere for me. And Restore 2, what we want to do is make sure that the people you communicate with also understand the tool. And when you speak to them about a deteriorating patient, that they're also they also understand what you're talking about. So what we're planning is some education and webinars with the GPs across Nottinghamshire. We're also planning some work with EMAS and also with the out-of-hours services that you speak to. So they will be there to help and support you and understand when you're using this tool. I know I did ask at the beginning if you're already using a deterioration tool, and if you are, that's not a problem, it's not wrong. And it's great to see that you're here to learn about Restore 2. Just because you're using another deterioration tool doesn't mean you can't access the training in Nottingham and Nottinghamshire. Provided you are in Nottingham and Nottinghamshire, contact us and we can have a conversation about what you're using and what you think you might get differently from the tool. Okay. And just finally, I know we've got some home care providers on the call today. It's really great to see you here. I know some of you are so keen to undergo the training, and we can't wait to deliver it to you either. There has been a delay in that, and that's just because we're making the tool a little bit more bespoke for the area that you work in. And with that, I would just like to move on to the aims of today's session. So if we move on to the next slide, please. So by the end of today, we will have reviewed recognising and responding to the deterioration, including soft signs, news to, and the structured communication method, SBARD. You will have had an opportunity to meet the Restore 2 team, network with homes across Nottingham and Nottinghamshire. I can see lots of things in the chat already, which is brilliant. And you will either learn or refresh your knowledge on Restore 2 and hear from those that are already using it locally. So without further ado, I would like to pass on to Michelle, who's going to give us an overview of the tool.
Good afternoon, everyone. It's really nice to see so many of you here. So I've got about 20 minutes to give you a bit of a whistle-stop tour, just explaining the tool to you. So there are 5 key elements to managing deterioration, which you can see on this slide, and I'm going to discuss these in a little bit more detail. The first thing is spotting soft signs of deterioration. So this is the early detection when somebody's becoming unwell. And then it's very important for us to know what's normal for our residents or those we care for. So to have a baseline so we know how they are at their best. The third thing is we do a set of physiological observations, and from that we get a News 2 score. And the News 2 score, the outcomes of that, the score, then determines what our escalation process should be. So depending on the patient's score, can we manage them within the home or community? Do we need to call a GP, or do we indeed need to call the ambulance service? And then the final part is the communications tool, also called the SBARD, and I will discuss and show you each of these things in a little bit more detail as we move through the training. So can you move to the next slide for me, please? Thank you. So the first thing we're going to look at is soft signs, and as I already mentioned, this is when somebody first starts to become unwell and will notice subtle signs in their change of behaviour. And this could be worsening or shortness of breath. Their skin might be different to normal, so it could be cold, clammy, hot, cold. Their blood sugars could be significantly different. And they might be more lethargic, withdrawn, anxious or agitated. They could become less mobile. Really obvious ones are when somebody's off their food or drink, or if their toileting habits are different to normal. Can we just pop on to the next slide, please? So this slide gives us a few more soft signs that we can look out for. It's quite a comprehensive list, but it's by no means exhaustive. Because you know the people you care for really well, you will know instinctively when you're communicating with them or looking at them if they're starting to deteriorate. So it could be things like, say you have somebody who likes to sit and do the the crossword in the newspaper every day, and then all of a sudden they can't be bothered to do it, or they like spending time with other people, so they're quite sociable, then they start to isolate themselves. Things like this are soft signs. Now this list here that is up on the screen at the moment, that's a really useful one, I think, to have printed out to share with your staff that are looking after people, because this shows them the sort of things they should be looking out for, those subtle changes in when somebody's starting to deteriorate. Can you move to the next slide for me, please? Thank you. So what this slide does is, this is the document that we use to just set out what's normal for the person we're looking out for. So this is if you look at the statement on here, it shows it's a really good example of a baseline. So this gentleman is normally fit and active, but he's often mildly confused in the mornings before breakfast. He has a normal news score of 0, and I'll explain news scores a little bit more shortly. So when he's at his best, his news score is 0. But in the morning, he may trigger on the alertness scale. So this might be that he's showing worsening confusion. The GP has said that we should only call them out if his confusion continues until lunchtime. And then it says to us that he's for full treatment and admission to hospital if required. And also that he becomes agitated when he's becoming unwell, which is a good soft sign for him. So what you can see is that by having that fairly short but concise statement, it tells us very clearly how this person is normally and the things that we need to look out for if they're deteriorating. Can you move to the next slide for me, please? Thank you. So, to look after somebody in the best possible way, it's obviously important that we know them really well. So what this slide does is it sets out what we should do when we first start caring for somebody. So whether we're going into their own home to care for them or when they come into our care facility. So what we need to do within the first 24 hours is we need to know what's normal for them. So if you think back to the previous slide, that statement that tells us how they are when they're at their best. And you can get this information from talking to the person themselves or indeed to their family and friends, whoever can give you that information. We would then undertake a full set of vital signs so that we can do a baseline news score. Following on from that, we need to understand their medical history and what medications they take. And this will also include, have they got any follow-up appointments that they need to go to? Are any test results awaited? Anything like that. And then we need to obviously always assume that somebody has the capacity to make their own decisions about the treatment that they want. And then we need to talk to their GP. So what things would the GP be concerned about? What would make the GP want us to contact them? And then the next thing is we need to have the limit of treatment and end of life discussions with them or their families so that they get the care that they want whilst we're looking after them or whilst we're going into their home. And this, what I'm going to do next is I'm just going to talk to you briefly about respect. Can you pop on to the next slide for me, please? So, respect document supports people to get the right level of care and support at the end of their lives. Now, all individuals should be offered an advanced care conversation with relatives, and if necessary, it would lead to the creation of a respect form. And this records their priorities and escalation plans. So respect is something that has been rolled out in parts of Nottinghamshire, and it's just starting to be rolled out in other parts of the county. So the respect actually includes their treatment, and it also can include things around DNA, CPR and things like that. So anybody can complete a respect form for somebody they're caring for, but they do need to be signed off by a GP or a senior nurse. And these are things that can be discussed at weekly MDT meetings as well. So what I would say is I know a lot of places are starting to use respect, and we can offer you further training on that if you want it. So if you want further training, either pop something in the chat or drop an email and we can arrange that for you. Can I have the next slide, please? Thank you. So what I want to look at now, and it will be fairly brief because obviously we're time limited as to how much we can discuss here, but I just want to give you a brief overview of the National Early Warning Score or the news score. This is based on 6 physiological observations, which you can see on the slide. So The first one is somebody's respiration rate. The next one is their SAT, then their blood pressure, then their heart rate, their level of alertness, and their temperature. Now, because I haven't got time to go through all of these in detail here, what we will do is share with all of you afterwards a link to a set of fabulous videos that have been created by Health Education England that are on YouTube, and they're really short, snappy videos that just talk about all of these observations, and they also give you a bit more of an overview of the tool. So what happens is that when we take these observations based on the readings, each observation is then scored between a 0 and a 3. A 0 is when somebody is okay, and then that progresses through to a 3 when they are becoming really very unwell. So what it says on this slide is that you have to get all 6 vital signs to do a news score. At the moment, particularly because we're in the middle of this pandemic, and we know that not all people that provide care can have all the equipment to do a full set of physiological observations, it has been endorsed by the Royal College of GPs that a partial news score is better than no news score at all. So what I want to do next is just show you briefly the sheet that we use to record news scores. Thank you. So this, I know it looks like really quite a busy sheet, but it's very, very easy to complete. As you can see, it's all color coded. So if somebody's reading is scoring within a white box, that's a 0. The yellow is a little bit outside that, the orange further outside, and the pink is when they're becoming really unwell. And if you look down that sheet, what you can see is that at the top, the top box, we record the respiration. The next, we look at SATs. Then we say whether they're on air or oxygen, blood pressure, pulse, their consciousness level, and their temperature. And then when we've done all of those observations, we then get a News 2 score. Can you pop onto the next slide for me, please, Annie? Thank you. So this here is the escalation route based on the score. Now, what I would say is that sometimes the person you're caring for might be exhibiting soft signs, but they may not trigger a news score. And what this means, this doesn't mean that they're not unwell. It just means that they've not triggered a score yet. You're the experts. You're the people that look after them. You know them better than anyone. So if you see that they're exhibiting soft signs and you're worried about them, they're scoring a 0, we would continue to monitor them every 12 hours. So do another set of observations every 12 hours until they're no longer exhibiting those soft signs, until you feel that they're back to normal. If they're scoring a 1, we would do observations every 6 hours, a 2 every 2 hours. A 3 to 4 or a 3 in one single observation, we would be doing it every 30 minutes. And then 5 to 6 is 15 minutes. And a 7 plus, we would suggest hospitalisation if that's in accordance with their treatment escalation plans. Now, I just want to say here that you might look at this and think, goodness, that's really frequent. That's a lot of observations to do. But all of you know better than anyone how very quickly elderly people can deteriorate. So doing a set of observations every 30 minutes gives us confidence that they're not deteriorating any further. Can I have the next slide, please? Thank you. So now what I want to look at is the SBARD, which is the communication tool that we use to get critical information that requires immediate attention and action. So this has five categories that we look at. So the first one is, first of all, you need to get all of this information together, and then you would phone your GP, 111 or the ambulance service. So the first thing is clearly the situation, who you are, who you're calling about. Tell them what the resident's news score is, and tell them what their normal baseline news score is. The reason you're calling I'm calling because the person is having shortness of breath, or I'm concerned that they have an infection, that sort of thing. The next thing we'd look at is the background. So this person's relevant history. So what medical conditions they have, what medication they're taking, if they have a respect form in place or a DNA CPR, and what that says, so that they're for full treatment for something that's treatable, or if they have a DNA CPR, if they don't want to be hospitalised, that sort of information. What we would do here is we would tell them then what the readings of all of the physiological observations are. So we would give them that information so that they can see how high somebody's respiration is, for example, or how fast their heart rate is. And then the next thing is the assessment. So summarise the facts, give your best assessment on what's happening. So you could say what you think the problem might be. Remember, you look after these people all the time. You know the symptoms they'll exhibit when certain things are happening to them. Say what you've done to help them, if you've repositioned them, if you've given pain relief, that sort of thing. The next thing is the recommendation, and this is where you get over what you want out of the phone call. What I'd like you to do is come and see this person within the next 2 hours. Can you tell me what you'd like me to do while I'm waiting for you to get here? So do you want, how frequently do you want to do observations? If the person's got just in case meds in the home, do you want to start on the antibiotics, that sort of thing? And then the last part is the decision. So this is where you have that brief interaction, you talk, right, so you've said to me that you're going to come out and see this person within the next 2 hours. In the meantime, you've asked me to perform observations every 30 minutes. You've said that if the person deteriorates further, you want me to call the ambulance. So you've got a record, a clear record of the discussion you've had and the decisions that you've made between you. Can I just have the next slide, please? So this slide here just gives you an outline of the sort of information that we'd use when completing an SBARD. So the situation at the top, who you are, who you're calling about, the background of his medical conditions, his observations, the last set of observations you've done, what your assessment is, and then finally the recommendation. This tool is great at giving people confidence to have those discussions with external healthcare professionals. And if you do decide to use this tool, I suggest that you use this as a practicing when you're doing handover, you know, at the end of shifts or to the next person that's coming in to look after someone. And that's me done. Thank you very much for listening.
That was lovely. Thank you so much, Michelle. And I'd just like to hand over to Christian now, who's come to talk about his experience of using the tool in the care home that he manages. Thank you, Christian.
Hello, everybody. Thank you for this opportunity for me to share our experience of this tool. So we found this tool really useful. I asked a question in the care home group around a detection of rapid deterioration tool. I can't remember exactly what it was, but I was signposted to Restore 2 at some point, and we used that opportunity, that training, to support our residents and staff as well. So how we used Restore 2 was we set up basically a folder, and we would have a Restore tool document for each resident, and we pre-filled those forms with the person's, how a person normally is, so what they normally like in terms of behaviour and things, any allergies, medical history, date of birth, NHS number, all those things that we would need to hand over to a medical professional over the phone, rather than having to kind of fumble about trying to find bits of information. So this, there was kind of a nervousness among staff and myself as well about, I mean, relating to COVID, in that, you know, we knew that GPs were probably not coming into homes anymore, and we weren't sure what was happening with nurses, whether there would be a redeployment somewhere early on. So there was a nervousness about us being a residential home. We don't have any nurses, any medical staff. So this tool was really useful in supporting us with that. Not that it makes up for it, but it supports, it gives us reassurance of what to look for, and ensures that we're giving the right information to those medical professionals who need to make decisions. We can have my next slide, please. Thank you. So just a scenario. We had a 92-year-old lady. Her norm was to be able to hold a conversation. She could feed and drink herself. She had been tested positive for COVID-19 around a week before, and she suddenly showed signs of deterioration, and we used the tool in this case. So there were soft signs. She suddenly stopped eating and drinking, very lethargic, the things that I'm sure everyone's seen by now. She was more confused, and she wasn't mobile anymore. And obviously we completed a full set of vital clinical obs, and a new score was about 9. So that prompted us to contact an ambulance, who attended, and we already knew that this lady, we'd had discussions with this lady's representative, so they wanted us to do everything that we could, even if it meant hospital admission. So we knew that we had to call an ambulance, and the ambulance crew didn't feel that was appropriate. She was very, very frail by that time, and they discussed it then with a consultant and the family member, and this lady did go into end-of-life care, and she did pass away later on, unfortunately. So even though this lady wasn't admitted into hospital, she was we know that she got the right treatment. We did everything that we could. We know, but we're not there to diagnose. We're not there to make decisions about whether someone's admitted to hospital or not. We're there just to gather the information and allow decisions to be made by medical practitioners and people with power of attorney as quickly as possible. So it allows us to get the support to residents in an effective way. So yeah, so that's it really. So thank you for that.
That's brilliant. Thank you, Christian. It's really helpful to, you know, have you come and talk about actually using the tool, and you know, and I want it to be clear, you know, we're listening to people who are using the tool and helping support them to do it. So thank you so much for coming on, Christian. So if we can just now pass on to Bridget to look at how we can support you. Thank you.
Thank you.
Thank you very much, Claire. Good afternoon, everybody. So there's just a couple of things I want to go over with you. First of all is the Restore to Competency framework, which Claire alluded to earlier. So the aim of having a competency framework really is for the trainers, the champion Restore to trainers that you may well have in care homes, can demonstrate the knowledge and understanding of the use of Restore to. So once they receive the training, they try and put this into practice and complete the competency framework, and then have the follow-up conversation with Michelle going through the different elements of the Restore to assessment and framework for them to then self-verify. But what I don't want care homes or the trainers to be is alarmed by it. It's really there as a supportive mechanism, so that if there is additional training needed or support in an area, that we can then put that in. But it's also to give you some reassurance that as we have been piloting this with a number of people that have been through the training, nobody's had any concerns at all with the assessment. It hasn't been a problem. So that is really good news. So the other elements that I just want to go through is around the kind of ongoing support. So as you know, you can have training on a certain topic, and it's when you come to then put it into practice that the learning and your experience really starts to develop and grow. So what we want to do is to be able to put a couple of mechanisms in, so that if you have got questions, you need additional support, you have really good learning and examples that you want to share with others, that we've got some form of way of doing that. So first of all, if we think about WhatsApp group, it provides that really collective and timely response amongst peers, as well as ourselves being on those groups as well. You might not feel that you want to post that into a group, your question or query, or into a community of practice. And you can email as well. So we've got a central email set up, and also Michelle's email, so that you can ask a question or have a query or a suggestion, whatever, and we'll be able to respond back to you. But the element that I'm really excited about is setting up of a community of practice for those that are using Restore to within the care homes, the trainers, for other staff that may want to join that, so that we can start to gather some peer-to-peer support, that we can share good practice, that we can provide tips to others that may have concerns or things aren't going particularly well, how we can all support them with those ideas and really celebrate what's working well together. So there are thoughts on providing some form of support for you going forward, but what I want to do is to ask you what you think about these. So if we could have our poll up, please, Annie, that would be great. Okay, so in relation to future support, how would you like support for Restore to once you've had the training? There is options here to put it a number in, so it's multiple choice if you want. We've identified a WhatsApp group. I mentioned the community of practice, as well as the email support. There's also the option of we'll set up all three of these, so you can dip in and out of which ones you want to. Or you may have other ideas which we really want to hear about. So if you've got other ideas that you think would be really useful to you around ongoing support, please pop that into the chat. So I'll just give that a few more seconds to run. Okay, can we have a look at what the thoughts are? So that's fantastic, thank you. And we'll take that feedback on board. So thank you, Claire. If I can come back to you.
That's lovely, thank you, Bridget. And so we're just kind of coming towards the end of today's webinar. So I'd just like to pass on to Samson for some closing comments as we just gather up the questions for our Q&A. Thank you.
Hi all, thank you so very much for joining this webinar. We are really appreciative and want to thank you all for showing up to this quick overview for Restore 2 and its associated components. We really hope that this session has been of benefit to yourselves and that it's been enriching towards your practice as highly valued care providers. I think it's important just to note and to mention that Restore 2 has been endorsed and promoted by the CQC, the Department of Health and NHS England. It fits in very well with the Aging Well and Enhanced Health in Care Homes agendas, which I'm sure we're all quite well aware of, as there is proven evidence that timely and appropriate escalation of deterioration provides benefits which leads to better outcomes for our patients and residents, whilst at the same time it empowers our care professionals to make appropriate and timely decisions. And this is what our aims and ambitions in terms of promoting Restore 2 aims to achieve. At the moment, we continue to promote Restore 2 in a paper format. We're currently in the beginning stages of scoping out digital solutions for these tools, which we hope will ideally link in with other digital systems which are currently in use by GPs, ambulance trusts, community settings, acute health settings, and so on and so forth. And as these become available, we'll be sure to keep you informed, because we do know that linking in care homes into these settings provides multiple benefits. So to draw this webinar to a quick close, it's important that we get a sense as to how you've benefited from this session. If you'd like a more in-depth one-to-one session and the best format for these sessions to be delivered. So we have a quick poll which consists of 3 questions. Please remember to use the scroll function. We'll throw the poll up right now. Thank you. We'll leave it for a minute or two. We're basically trying to see what benefits that you believe you will get out of Restore 2, and if you'd be interested in receiving further information. And we have quite a number of participants on the call, so it'll be interesting to get a feel as to how you found this quick session, how you'd like to be contacted, and the best format that you feel that this would apply for you in your setting. This will really help to inform our local efforts as a Nottinghamshire team. And we're also quite mindfully aware that we've also got people from other areas as a part of this. So we'll just leave it for a few more seconds. I think we're quite good on time. So I'd also like to encourage people to continue to use the question and answer function. There have been some good questions and some good engagements coming through to that. There's some really healthy conversation and comments as well within the chat. Thank you all for that. So I'll just quickly draw the polling to a close. Thank you very much, Annie. So great overwhelming response. I think it's basically the house is quite is quite clear. For those who don't already use it, the rest greatly think that Restore 2 is really useful in their setting. We have an overwhelming 79% saying that they would like to be contacted. So please feel free to drop your contact details, and we'll leave contact details as well. And the majority, happy for an online training package, something we're definitely scoping out. The face-to-face training is definitely an option. And of course, the virtually via video conferencing, highly in favor. That is, highly, that is really great. Thank you all. Really great. We've got contact details for Michelle Tuttle, who delivers the training across the Nottingham and Nottinghamshire county councils. So please feel free to use those contact details should you wish to have further contact. You might have also come aware of this via the ECRT teams as they come across your areas. So of course, please do lap the information as it comes. We've also got one more poll question, which we'd like to throw up really quickly. It's just one last question. Brill, would you like to be contacted for a recording of today's webinar? And this is basically for us to have contact details with yourself and how you would like for us to retain and maintain contact of not just more in-depth information, but also alludes to a lot of other side projects that we have associated with this, such as the communities of practice and the WhatsApp forums, which we believe would greatly help to benefit us from that. I'll just leave this to run for a minute or so as well, so that we can get quite a comprehensive overview of people's views as to this. Would really like to further this work, just as Claire had said. It's not just, we are mindful that this has been introduced as part of the COVID-19 response, but this goes, deterioration, as we all know, it definitely goes further and beyond. Thank you. If we could just draw that to a close. Brilliant. Thank you. We'll use the associated email addresses that we have, an overwhelming 92%, with I think 3% providing other contact details. It's been really, really helpful to get those sort of comments. You might also have come across a questionnaire, which we're trying to distribute quite widely across the East Midlands. And it's come from the East Midlands Patient Safety Collaborative, which is part of the Academic Health Science Network. The aims of this is to try and scope the use and understanding of deterioration tools and treatments escalation plans across the East Mids. We would really appreciate your support in completing this, as it helps us to inform our understanding and best place associated support plans, which inform developmental work for care homes and the health system as a whole. So of course, please, by means of you guys taking out time, it's just a few questions basically asking what your current practices are within your particular areas. It'll really help inform our next steps as we plan to further develop this for the rest of the year. A video recording of this webinar, of course, will be sent to all attendees. It'll also be uploaded onto YouTube in the next couple of days, so please feel free to refer to this if necessary. It's also important that as part of this ongoing We Are All in This Together webinar series, the next webinar in the series is for meds management and infection prevention and control within your settings. For those who are registered or ready to receiving these, you continue to currently receive invites. If you're new to this, please feel free to sign up and join us on this really valuable subject matter. We really hope that you found a lot of benefits to this session, and we really want to thank you again for all taking out the time to participate actively and for lapping up the information that's been disseminated here. And of course, you know, we would definitely be looking to further on this work with yourselves via the increased contact and try to embed this quite widely, not only within the healthcare system, but also in your homes to empower you in terms of your working practices as well. So on this note, Claire, I don't know if you want to come in or if we're happy to close at this point.